Question 1. A prescription reads IGTTOU bid. How should the patient be instructed to use the drops? A. In the right eye. B. In the left ear. C. In both eyes. D. In both ears. Answer: C. In both eyes. This question tests your knowledge of SIG codes for the route of administration, specifically for the eyes. The keywords are GTT, which means drops, and OU, which is the Latin abbreviation for oculus uterque, meaning both eyes. This instruction is common for conditions like glaucoma or dry eyes that affect both eyes, requiring medication in each. A good way to remember this is that O stands for oculus, eye, and U stands for uterque, which you can think of as universal or both. Question 2. Translate the following SIG: 2 caps per HSPRN pain. A. Take 2 capsules by mouth at bedtime as needed for pain. B. Take 2 capsules by mouth every hour for pain. C. Instill 2 drops in the ear at bedtime as needed for pain. D. Apply 2 capsules to the skin as needed for pain. Answer: A. Take 2 capsules by mouth at bedtime as needed for pain. This question requires you to interpret a combination of common SIG codes. Breaking it down, 2 means 2, caps means capsules, PUT is by mouth, HS stands for orasomni or at bedtime, and PRN means as needed. Assembling these pieces in order creates the full, correct instruction for a medication used to manage pain, especially if it interferes with sleep. Think of translating SIGs like reading a short sentence where each abbreviation is a word you need to know. Question 3. What does the SIG code AC mean? A. At bedtime. B. After meals. C. Before meals. D. With meals. Answer: C. Before meals. This question tests your understanding of medication timing relative to food. The SIG code AC stands for the Latin phrase anticipum, which translates to before meals. This instruction is important for certain drugs, like some diabetes medications or stomach acid reducers, that work best when taken on an empty stomach before food is introduced. A simple trick to remember this is that ante means before, like in the word antecedent, which comes before something else. Question 4. The abbreviation UNG refers to what dosage form? A. Capsule. B. Syrup. C. Ointment. D. Lozenge. Answer: C. Ointment. This question tests your knowledge of abbreviations for different medication dosage forms. The SIG code UNG is short for unguentum, the Latin word for ointment. Ointments are semi-solid, greasy preparations applied externally to the skin, such as a topical antibiotic or steroid cream. For example, a prescription might say, apply UNG to affected area bid. You can remember this by associating the UNG sound with the word unguentum. Question 5. The SIG supp PRQ6H indicates which dosage form? A. Tablet. B. Suppository. C. Ointment. D. Solution. Answer: B. Suppository. This question is about identifying a dosage form from its abbreviation in a SIG. The keyword here is supp, which is the standard abbreviation for suppository. A suppository is a solid medication form designed to be inserted into a body cavity like the rectum, PR4 per rectum, where it melts to release the drug. Therefore, this SIG instructs the patient to insert 1 suppository rectally every 6 hours. Question 6. A prescription written for QOD means the medication should be taken. A. Every day. B. Every other day. C. Twice a day. D. Once a week. Answer: B. Every other day. This question assesses your knowledge of a common but often confused frequency instruction. The SIG code QOD stands for every other day. It is frequently a source of medication errors because it can look similar to QD, every day, or QID, for times a day, so some institutions avoid it. This dosing schedule is used for drugs with a long half-life or to minimize side effects. The easiest way to remember is to think of the O in QOD as standing for other day. Question 7. The abbreviation SL directs the patient to administer the medication. A. Under the tongue. B. In the cheek. C. On the skin. D. By inhalation. Answer: A. Under the tongue. This question tests your knowledge of routes of administration. The SIG code SL is an abbreviation for sublingual, which means under the tongue. This route allows for medication to be absorbed very quickly into the bloodstream, bypassing the digestive system entirely, which is ideal for emergencies. A classic example is nitroglycerin SL tablets for acute chest pain, angina. A helpful way to remember is that lingual refers to the tongue. Question 8. The abbreviation PC on a prescription means: A. By mouth. B. After meals. C. Before meals. D. With food. Answer: B. After meals. This question tests a timing instruction related to meals. The SIG code PC stands for the Latin term post cibum, which translates to after meals. This direction is typically for medications that could cause stomach upset or are absorbed more effectively with food in the stomach. For instance, a nonsteroidal anti-inflammatory drug, NSAID, like naproxen, is often taken PC to reduce gastric irritation. Remember this by thinking of P for post, as in post-game, which means after the game. Question 9. What does the SIG code UD mean? A. Until directed. B. As directed. C. Use daily. D. Do not use. Answer: B. As directed. This question is about an instruction that refers to verbal directions from a prescriber. The abbreviation UD comes from the Latin phrase ut dictum, meaning as directed. It is used when a prescriber gives complex instructions to the patient, such as a tapering dose schedule for a steroid, and writes UD on the prescription instead of the full directions. If you see this, it's a cue to confirm with the patient that they understand the doctor's specific instructions. Question 10. A prescription for eye drops has the SIG IGTT ad TID. Where should the medication be administered? A. In the left eye. B. In both ears. C. In the left ear. D. In the right ear. Answer: D. In the right ear. This question tests a specific SIG code for the route of administration, requiring you to distinguish between eye and ear abbreviations. The key code is AD, which stands for oris dextra, the Latin term for right ear. The A signifies oris, ear, while the D signifies dextra, right. It's crucial not to confuse this with OD, oculus dexter, which means right eye. An easy tip is to remember A is for audio, related to hearing/ears, and O is for optic, related to vision/eyes. Question 11. What is the meaning of QH on a prescription? A. Every hour. B. Every other hour. C. At the hour of sleep. D. Every 4 hours. Answer: A. Every hour. This question assesses your knowledge of frequency abbreviations, particularly for short intervals. The SIG code QH stands for quaque ora, which is Latin for every hour. This is most often seen in hospital or institutional settings for medications that need to be administered frequently to maintain stable blood levels, like certain pain medications. Be careful not to mix it up with QHS, where the HS part means at bedtime. Question 12. Translate the SIG, INH 2 puffs Q4-6 HPRN sob. A. Inhale 2 puffs every 4 to 6 hours as needed for shortness of breath. B. Inject 2 units every 4 to 6 hours as needed for blood sugar. C. Instill 2 drops every 4 to 6 hours as needed for sinus blockage. D. Take 2 pills by mouth every 4 to 6 hours before sleep. Answer: A. Inhale 2 puffs every 4 to 6 hours as needed for shortness of breath. This question requires translating a common SIG for an inhaler. The key abbreviations are INH, inhale, puffs, a measure for inhalers, Q4-6H, every 4 to 6 hours, PRN, as needed, and sob, shortness of breath. Combining these logically leads to the instructions for a rescue inhaler, such as albuterol for asthma. Recognizing sob as an abbreviation for shortness of breath is critical for understanding the medication's purpose. Question 13. The term stat on a medication order means: A. At bedtime. B. As needed. C. Immediately. D. In the morning. Answer: C. Immediately. This question tests an instruction related to urgency. The term stat is derived from the Latin word statum, which means immediately or at once. A stat order is a top priority and indicates that a medication must be administered without any delay, often in an emergency or critical care situation. For instance, an order for an epinephrine injection stat for a severe allergic reaction must be carried out right away. Just think, when you need something stat, you need it now. Question 14. What does the SIGO mean? A. Each ear. B. Each eye. C. By mouth. D. On the skin. Answer: A. Each ear. This question tests the SIG code for administration in both ears. The abbreviation O stands for oris uterque, which is Latin for each ear or both ears. This instruction is necessary when treating conditions that affect both ears, like a bilateral ear infection requiring antibiotic drops. A simple way to keep the ear and eye codes separate is to remember a for oris, ear, and U for uterque, signifying both. Question 15. The Roman numeral SS in a SIG code represents the quantity. A. 1/2. B. 1. C. 5. D. 10. Answer: A. 1/2. This question assesses your knowledge of Roman numerals and Latin terms used in pharmacy practice. The symbol SS comes from the Latin word semis, which means 1/2. You might see it on a prescription as ISS tabs, meaning 1.5 tablets. Although its use is now discouraged to prevent medication errors, as it can be misread, it is still important to recognize it. You can remember this by thinking of SS as a split S, hinting that it represents half of something. Question 16. A patient is told to take a medication QHS. When should they take it? A. Every hour. B. Every morning. C. Every night at bedtime. D. After every meal. Answer: C. Every night at bedtime. This question tests a specific time of day dosing instruction. The SIG QHS is an abbreviation for the Latin phrase quaque ora somni, meaning every night at the hour of sleep, or more simply, at bedtime. This instruction is common for medications that can cause drowsiness, like certain antihistamines, or are most effective when taken at night, like statins for cholesterol. A helpful tip is to focus on the HS part, which stands for ora somni, or hour of sleep. Question 17. How should a medication with the SIG ITAB PTCB be taken? A. 1 tablet by mouth twice a day. B. 1 tablet by mouth 3 times a day. C. 3 tablets by mouth once a day. D. 1 tablet by mouth 4 times a day. Answer, B. 1 tablet by mouth 3 times a day. This question tests one of the most common frequency abbreviations. The key code is TID, which is from the Latin ter in die, meaning 3 times a day. The rest of the SIG, itabpa, means 1 tablet by mouth, so the full instruction is to take 1 tablet by mouth 3 times daily. It's useful to memorize the main daily frequency codes, BID4 twice, TID4 3 times, and QID4 4 times. Question 18. A prescription reads NR2. What does this mean? A. No repeats for 2 months. B. Do not refill. C. 2 refills are authorized. D. Refill 2 times. Answer, B. Do not refill. This question is about interpreting refill instructions on a prescription. The abbreviation NR simply stands for no refills. This means the prescription is valid for 1 fill only, and the patient will need a new prescription from their prescriber to get more of the medication. The two in this particular example could be confusing or unrelated information, but the core meaning of NR is the crucial part to know. Just remember, NR means the prescription stops after the initial dispensing. Question 19. The SIG buck indicates that a tablet should be placed. A. Under the tongue. B. In the cheek. C. Swallowed whole. D. Dissolved in water. Answer, B. In the cheek. This question tests a specific oral route of administration. The SIG buck is short for buccal, which directs the patient to place the medication in the pouch between their gum and cheek. This route allows the drug to dissolve and be absorbed directly into the bloodstream, similar to the sublingual route. A good way to remember this is to think of a bucket being held in your buccal cheek pouch. Question 20. A prescription for eardrops with the SIG 2GTTS as BID should be administered how? A. 2 drops in the right ear twice a day. B. 2 drops in both eyes twice a day. C. 2 drops in the left ear twice a day. D. 2 drops in the left eye twice a day. Answer, C. 2 drops in the left ear twice a day. This question tests the specific abbreviation for the left ear. The critical SIG code here is AS, which stands for oris sinistra, the Latin term for left ear. The 2GTTS indicates 2 drops, and BID means twice a day. It is vital to distinguish as left ear from AD, right ear, to ensure correct administration. A helpful mnemonic is that SINIS stands for sinister, which means left. Question 21. SIG, ITAB PQID. What does QID mean? A. For times a day. B. Every 4 hours. C. Once a day. D. As needed. Answer, A. For times a day. This question tests a common frequency instruction. The SIG code QID comes from the Latin phrase quater in die, which means 4 times a day. It's important not to confuse this with Q4H, which means every 4 hours, totaling 6 times in a 24-hour period. QID dosing is typically spread out during waking hours, for example, at breakfast, lunch, dinner, and bedtime. A good tip is to associate Q with quater, like a quarter, to remember the number 4. Question 22. The abbreviation PRN indicates that a medication should be used. A. At a regularly scheduled time. B. Only at bedtime. C. As needed. D. Every other day. Answer, C. As needed. This question tests a fundamental instruction regarding dosing schedule. The SIG code PRN is an abbreviation for the Latin phrase pro re nata, which translates to as the situation arises or, more simply, as needed. This is used for medications intended to treat occasional symptoms, like pain relievers for a headache or anti-nausea medication. A key takeaway is that PRN medications are not taken on a fixed schedule but only when the patient experiences the specific symptom it's meant to treat. Question 23. The abbreviation OS on a prescription for drops means A. By mouth. B. In the left eye. C. In the right eye. D. In the left ear. Answer B. In the left eye. This question tests your knowledge of ophthalmic, eye-related, SIG codes. The abbreviation OS stands for oculus sinister, the Latin term for left eye. Accurately interpreting this is critical to patient safety, as administering medication to the wrong eye can be harmful. It's easily confused with OD, right eye, and OU, both eyes. A simple way to remember is O for oculus, eye, and S for sinister, left. Question 24. A prescription with SIR in the SIG refers to what dosage form? A. Suppository. B. Syrup. C. Spray. D. Syringe. Answer B. Syrup. This question asks you to identify a liquid dosage form from its abbreviation. The SIG code SIR is the common abbreviation for syrup, a liquid medication in which the drug is dissolved in a sweet, viscous solution. Syrups are frequently used for children or adults who have difficulty swallowing solid pills, such as many cough medicines. This is an easy one to remember, as SIR are the first three letters of the word syrup. Question 25. Translate the SIG, ITAB PQD AM. A. 1 tablet by mouth every day in the morning. B. 1 tablet by mouth every other day in the morning. C. 1 tablet by mouth as needed in the morning. D. 1 tablet by mouth at bedtime. Answer A. 1 tablet by mouth every day in the morning. This question requires you to combine several common SIG codes into one instruction. The individual parts are ITAB, 1 tablet, P, by mouth, QD, every day, and AM, in the morning. When you put them together, they form the complete direction, take 1 tablet by mouth every day in the morning. This is a very common SIG for medications like diuretics or thyroid hormones. Remembering that AM means morning and PM means evening is a fundamental tip for getting time of day instructions correct.